We're going to start this class with discussing the skeletal portion of our bodies. Um, in this particular slide sessions, uh, we're going to discuss fractures and injuries. And then in the second group, the second lesson, we'll discuss the anatomy of the skeletal system. So it's important to understand that we need to take care of ourselves, and the physical work that we do now when we were children, such as playing and having resistance, walking, weightlifting, actually can build up your bones so that when we're older, like my age or even older than I am, the bone density will be of great value to us, and we won't have cribiosis, which we'll discuss, which is part of the diseases later on in this lesson. And we could avoid a lot of calcium deficiencies and things like that. But the problem is that when we are young, we don't realize that when we get older, what we do now will affect our age group when we're older. So the density of our bones is actually affected by the amount of activity we are in our youth. Did we participate in sports? Did we run? Did we weightlift? Were we active in our youth? Or did we have a sedentary lifestyle? Watching TV, doing video games is not considered an activity. So you got to understand that we're coming up to a crisis with the younger generation growing up, doing less activity, and also the fact that society has changed a great deal, and that has also affected our outcomes. So as the generations get older, we're going to probably have more and more accidental fractures, calcium deficiencies in the elderly, uh, cribiosis, simply because they didn't store the calcium or pack the calcium or pack the bones density prior to reaching adulthood. So that's an important thing to remember, is that we grow up, we're actually building our future. On this slide, you see that there are various types of fractures. Green stick is an incomplete fracture. Broken bone is not completely separated. Now, green stick is kind of a funny name, but this is most common in kids. Um, what it is like you ever took a green stick or a tree branch that from a young sapling or a young tree, and then you try to break that into two. When you do, it just bends, and then it might a sliver, a fraction will come off and partially break, but you can literally bend it almost into a complete circle, and it may not even break then. It just bends, but you still got partial break there. So it breaks on one side or the other. Sometimes the green sting is just an abnormal shaping of the bone caused by stress and play. So children usually get this quite often. Then you have, there's a transverse, it's not listed here, but the break is in a straight line across the bone. Uh, you have a spiral, right? A twisting action where you twist your arm. You ever seen those karate moves in movies? You know, they twist the arm, and that would cause a spiral break if they continue on with the action. But we all know it's fake, so there you go. So you got oblique diagonal break across the bone, right? And you have compression. Compression is when it presses. Like if you was to jump from a building, and you're basically driving your knees into your popliteal, right into your knees. You know, you're driving everything in your ankles, your knees are driven in on top of each other as you land on your feet. That's how come if you're going to fall, you want to do a roll. Even then, you could get a fracture of your scapula. So it's important to know how these compound compressions can be. You have to communicate. The break is in 3 or more pieces, and it diffuses, and it's on the list here. It diffuses into the tissue. It gets embedded in the surrounding tissues. It like shatters. You have segmental. The same bone is fractured into 2 places, and you have a floating segment in between. So you basically have broken the top and the bottom, and you got this piece in the middle that's floating around. And that can be quite important, that it has to be stabilized, because that piece floating around can drive itself into the vascular system of the tissue or bone, or hit an artery and you can bleed out. So it's important that you know that is the segmental it can be dangerous. Then you have the Colles fracture. This is in the wrist area, and the Potts is in the ankle. Um, so it's important to know some of these fractures. Here we have an illustration. I'm just basically going to talk to you about what causes fractures during this particular visual slide. Fractures occur when there is more force applied to the bone than the bone can absorb. Bones are weakest when they are twisted. And that's that twisted action to spiral injury. Breaks of bones can occur from falls trauma or as a result of a direct blow. Uh, your bones are also maybe more likely to break if you are a smoker. So if you smoke, quit, because it's just one more reason not to smoke, because it is detrimental to your musculoskeletal system. Uh, Treatment for the fractures will be determined by the physician, of course, but usually it's based on the age, right? Your overall activity uh, and overall health, which is, your medical history, because some people cannot tolerate certain medications and certain extensive procedures. The extent of the condition. Uh, as you can see, you got the closed, you got the open compound, you got the commuted. Now, green stink, that's pretty self-explanatory. Usually, you just have to put that in its original position, and you're good to go, and just treat the pain. And over time, it will mend itself, and it's usually in children, and that's the problem. Keeping children still can be quite a chore. Your tolerance for specific medications is also considered during your treatment. Expectation for the course of the condition. What is the expectation of the patient? If the patient is an athlete, and let's say it's a dislocated collarbone, for example. Now, I know that, I'm speaking ancient times when I bring up my father. My father was a football player at at the Memphis State University. It's a university now, but it was a college back then. And he was dislocated. His shoulder bone was dislocated, and his college career in sports was, pretty much deceased and desist. But in today's world, in today's treatment of a collarbone for injury or dislocation is not going to knock you out of football. They got treatments today that will pretty much rectify that, and you can be, with care and over time. Probably you'll miss a season, but you'll be back in the game the very next season. So it's things have changed in the treatment. So as you can see, medicine gets better. Um, you got to understand that patients have a preference to how they want to be treated as well. So uh, as being healthcare providers, that may be a little annoying to us, but that's the truth of the matter, is that the patient in the end gets to decide the direction of their care, especially if they're adults. So you have to consider that as well. The goal is to control the pain, okay? Promote healing and prevent further complications. Restore normal use of the fractured area. So there's quite a few goals involved in that. Now, can normal use be achieved? Well, or can a new normal be achieved? Those are the kind of things that are looked at when you're caring for fractures of the bone. Depending on your age group and depending on your needs to how you want to desire your recovery to be, then yes, the goals may be complete recovery or a new norm, especially for geriatric patients. So that should be. Go to the next slide here. So here I am. I'm back. I didn't go that far away. So now we're like in the different types of repairs for the fractures. And you have, right on the top you have closed and open. And closed is kind of self-explanatory. There's no surgical opening to manipulate positioning of the bone to get it aligned. You're pretty much doing that from the outside, whether you have to, put it in a sling or a cast to prevent it, and you align the bone that way. So the alignment, the realignment, it can be quite painful. So pain medication sometimes is administered prior to realignment. Do understand that when bones break, your muscles are like rubber bands attached to the bone, and they're just slinging it back. So the bone may be out here right now, but when it breaks, Whoops, there we go. Give me a good video. Yeah, there we go. When it breaks, it may be this long, right? So, but when it breaks, it gets offset and it gets just no longer that long because the muscles are pulling it in like a rubber band. So now you got to pull it out and line it up and then secure it from the outside with a cast, right, or a splint, so that you can so it can heal properly. Now, open reduction, it's a surgical way, and it uses wires, and you'll see. I don't know if you've ever seen somebody with a wrist injury or a hand injury where they got these medical contraptions hanging out their fingers because they broke their hand and their wrist, and they got pins. YouTube has a great video of those, by the way, if you want to dabble in looking at those surgical procedures for repairing bones. They put pins in. They have to be removed. um, Traction is the application of a force to stretch certain parts of the body in a specific direction. Traction consists of pulleys, strings, weights. So you ever seen those? A lot of times you see them in comedies like the Three Stooges. I don't know if you've ever seen the Three Stooges, but the Three Stooges, you got these guys who are in bed, and they just had an individual in bed with his leg up, with the sling extending out. Well, that's hype. That's traction. They're tracting the leg so that the leg can be lined up properly and heal. Um, in the old days, they used to keep you in the hospital for a period of time until the knitting of the bone occurred. Um, so that's a thing to remember. It takes several days or several weeks before the netting will occur and the bone begins to heal. Then they get it in the right direction and they say, okay, it's healing properly. We can discharge the patient home and have them take care of themselves by staying off of it as much as possible. But they used to put you in a bed and hyperextend you like that. They pretty much try to avoid that nowadays because it's not a very comforting thing to do. The purpose of the traction is to stretch the muscles and tendons, okay, around the bone, the broken bone, to allow the bone ends to align and heal. So you're stretching the muscles back out. So that's what we do. Then you have, we talked about the surgery, which is surgical intervention. Um, there are certain types of broken bones back into the place. So occasionally, internal fixation, they're metal rods or pins located inside the bone, or external fixation devices, which are outside metal rods and pins located outside of the body and are used to hold the bone fragments in place to allow alignment and healing. So this is dedicated to aging. Aging causes a variety of anatomical and physiological changes. Knowledge of age-related anatomical and physiological changes allows for the understanding of the pathophysiology differences between elderly and the rest of the adult population. Now remember, in the beginning of this lesson, that's the first thing I opened with practically was the fact how important it is for us to be active in our youth in order to build up bone density and to apply stress on our bones and to build up strength in our structure and our skeletal strength. So it's very important that we are active in our youth because when we're young, that's when we can store and impact our density of our bones, the strength of them, and our agility of the muscle tendons and things like that. And it will last us our entire age, our entire lifetime. So uh, muscle mass loss is one of the multiple age-related physical changes involving a condition known as sarcopenia, which is deterioration of the muscles. Now, you can imagine now, you've got to understand, you've got stressors on your bones right now being caused by the elasticity of your muscles. Now, these stressors are being pretty much uh, deteriorating due to the fact of aging. So that pull on your bone tissue is less. So it doesn't need the bone is saying, well, hey, I don't need to be as dense as I used to be. I don't have to work as hard as I used to be, so I can be thinner. I can be less dense. I don't have to store it. So that's what's important to know about. The more you have stored up, the more it lasts over time, which has been associated to the loss of physical activity. That's the sarcopenia. Because if you loss of physical activity, it, living a sedentary lifestyle, like me sitting in this chair talking to you instead of walking around the block, uh, can cause my muscles to uh, develop sarcopenia. So it's important that we use it or lose it. You ever heard that one before? Uh, Muscle mass is thought to be related to the motor neuron loss due to the aging process. Another disorder related to aging is bone mass loss. Here's the one, osteopenia. Notice the similarities between the words sarcopenia, osteopenia. When we do muscles, and we will, you'll hear the sarcopenia again. It comes right around like a big circle. So, osteopenia, which can further progress to osteoporosis. Now, who hasn't heard that one, right? As you get older, I'm going to avoid osteoporosis. Drink your milk, get your calcium, but you've got to understand, in order for that calcium to get stored, you've got to have an active lifestyle. You just can't drink your milk and expect, hey, I've done my job, and go play video games. No. You drink your milk and play soccer. There you go. Drink your milk, climb a tree. Go do something physical so that it gets stored away in your bones. Uh, the body works in response to what is required of it. And the more that we require from our body, the better our body builds tissue and is able to refuel itself. So those are the kind of things you need to think about. The gold standard for measuring bone material properties in clinical practice is the axial DX alpha, delta X-ray alpha measurement from the femur and the spine. So um, now men don't usually go through this; they probably never experienced anything like it. But women will have this measurement done as they get older, and so they can check their density out because these problems of bone density decline, it seems to be prevalent in the female uh, group. So those are to consider. And I really would encourage you, if you're active in sports, if you're bowling, or if you're playing golf, or if you're a basketball player, or if you're a runner, continue that habit, continue that sport activity. You can play tennis. There's a lot of things you can do. Uh, Joining a tennis club is a great social moment, and it keeps you active. So keep that in mind. Here we have other bone and joint injuries. Whiplash is a lawyer popular expression, but it does occur, and it certainly can be very, very painful. It's a strain or sprain, as you can see, sprain is on the list, of the neck. And it can be very, very painful as well. You have a dislocation of the bone. That's removing it. That's a joint area. When the two bones where they meet at the joint become misaligned, uh, that is also painful. You've probably seen those in the movies where they grab the shoulder and they put it back in, they pop it back in. It's usually not the first thing that they do, but in the movies, they usually the first thing they do. You have the hammer toe. Hammer toe is caused by an imbalance between the muscles and tendons in your feet over time. This imbalance can lead to structural and neurological changes to your foot and toes. Shoes that don't fit you properly or that force your toes into a cramped position. Narrow position can aggravate the hammer toe. So, um, so it's important to wear shoes that fit properly and are comfortable. Now, rice will definitely is a very common way to treat sprains and fractures, and injuries of this sort. Rest, ice, compression, elevation. Um, so we'll discuss this. We'll go further into this. Talk about the sprain because whiplash is nothing more than a neck sprain. So neck sprains, like other sprains, will usually heal gradually, given time and appropriate treatment. You may have to wear a soft collar around your neck to help support the head and relieve pressure on the ligaments so they have time to heal. So if you often wonder why do they wear the collars, not to immobilize them, it's so that the head underneath the chin and the back of the head can literally rest on that collar rather than strain the neck with your movement and your positioning of your head. So you're actually resting your head on the collar. that surround your neck. So that alleviates the strain of the tissues. Muscle relaxants can help ease the spasms of your neck. Uh, so that's important. That they got drug treatments can be done. So now dislocation, we told you about that as it fits into a joint or shoulder, right? It slips or pops out, and you have to dislocate its shoulder. Now, treatment is usually a rice. The rice right down. That's probably the reason why we have it on the slide, right? Rest, ice, compression, and elevation. Now, you say, well, how can that help these two joints to get back together again? Well, once it's kind of manipulated and properly aligned, and the joints don't go back into their sockets, let's say, or into their place, that means they're swollen. So rest, ice, and you can compress the area to keep it from swelling at that site. You can force the tissue swelling lower down the limb with the compression, and you elevate the limb to keep the blood from getting to the injured area. So you're all trying to avoid swelling, so the swelling will depreciate, and then the injury can pop right back into the joint. So that's important to think about the rice treatment for that. And then the secondary treatment, which is the next one, is manipulation or repositioning. That's where the physician will manipulate the injured joint area and attempt to place it back into the socket. Sometimes they reposition it to allow the ice treatment to be better successful. They may not completely put it back into the socket. They may continue with the rice, but after the repositioning. So aligning it up is important. Um, so it's important to understand that rice is a great way of treating uh, many of these joint injuries. So diseases of the bone and joints. Arthritis is it means arth, which is joint. Itis means inflamed. So it's joints, and there's two types of arthritis. One is rheumatoid, and the other one is osteo. Rheumatoid arthritis is a chronic autoimmune disease, and what this means is that chronic means it's ongoing and continuous, and has a history of being present. It's not something new. It's not acute. Acute means new onset, and chronic means been there a while. Now, autoimmune is it's automatically your immune system basically is attacking your good tissue in your joints. It's usually caused by a stressful environment. Now, in today's society, we have numerous stressors. Me getting ready to do this video and wearing this lime green shirt, look at that. Yeah, pretty awesome. I had to get out the brightest one so you could see me. So the thing is that we wanted to let you know that stress is a real important thing to try to avoid in our lives. It causes all kinds of problems, aging, hypertension. It could be the root of all our problems and illness, stress. So, well, that's great. You know, stress. I know I got chronic autoimmune disease. So I've got rheumatoid arthritis. How's that going to help me, William? I mean, really, stress. How am I going to avoid it? Well, you need to know how to deal with it. And one of the ways to deal with it is it's a simple procedure. It's like when you're feeling, tense and upset, and you get one of these rheumatoid arthritis attacks, and you have to realize that, oh, this is a stressful moment. It's occurring to me. You might want to go to a quiet room, play chimes, slow, deep breaths, concentrate on being peaceful and calm, and on your breathing. Uh, Listen to some nice music or ocean sounds, birds, nature. You can usually get that on the internet, and you can listen in a dark, quiet way. Just take a few moments to yourself, a little private vacation in your mind of relaxation, and see if that alleviates the pain. Moving around is also, now we're talking about alleviating stress to avoid rheumatoid arthritis. So short walks has always been a great reliever of stress. So walking, share, have a good listener in your life, share things with them, talk things through, discuss your problems and your relationships with others. And another thing, prioritize. Take a moment each morning and before you fall asleep, think about that to-do list you got. You know, the to-do list. Does that list really need to get done? And if it's so, if it has to get done, do you have to be the one that does it? Um, Sometimes just creating your own stress by making a to-do list can be a problem as well. The last one here is vitamin D in children. Vitamin D is attained from sunlight. So children nowadays are pretty much in the home playing video games, not going outside like when I was a young crumb rugrat or crumb snatcher. Uh, I used to just go, "Hey, mom, I'm leaving," grab my baseball bat and glove, and be gone, and wouldn't come back on until the lights came on in the streets. Then I would have to be home. If I wasn't home before those lights were on longer than 10 minutes, I would get, in trouble, big time. But the whole neighborhood was like that. So all the kids were outside. Um, we might drop in to have a lunch. That's about it. A sandwich to go. I'm in a hurry, mom. Gotta go. It was a very free society, free of fear and things like that. But in today's society, you have to go outside and watch your children outside. You just can't trust them to be alone out there because of the villainous behavior of numerous people in our population. So, uh, but you can easily avoid rickets by making sure that your children receive outdoor time in the sun, and or go to the beach or go to the pool and things like that. Of course, you don't want to overexpose them to the sun. We know how nasty that can be. So you don't want any sunburns, but exposing them to the sunlight will ensure they get their vitamin D. Um, and they need to drink milk as well as have an active lifestyle. Well, these disorders are involving the bone are present, and I figured I would kind of like go retroactive and talk about. These are kind of self-explanatory. They're all right before you on the slide. They're pretty much what they are. I don't want to sit here and just read it to you. You can see it. So I'll talk about gout, which I didn't do on the previous slide. So gout is pretty unique. If you've read anything in literature, if you read Old English literature and things like that, you have numerous cases of the old man Will in the Teeple Tower above the baker's home was laying in his chair with gout. As, those kind of things. Well, what is gout? Well, it's a it's a uric acid levels uh, that can be caused by certain medicines, diets, and things of that sort. So it's a if you're in today's society, it's if you drink a lot of beverages sweetened with fruit sugar, fructose, for example, uh, it increases your uric acid because it's a byproduct of the breaking down of fructose into glucose, and you get a uric acid buildup in your blood. Um, Seafood and meats, diets and meats. So if you're on a ketone diet, you can develop uric acid buildup. One of my favorite consumptions is especially beer is a problem. So you can imagine they drank a lot of ale in the olden days, and that's basically another word for beer. That also increases the risk of gout. Um, Obesity, like my chubby complexion, that's not good for gout. Um, you probably say, "Well, William, have you had gout?" I've only had about one or two incidences where it was in my toe. Uh, it was a long time ago. And pretty much haven't had any more. Into that, it came and went. Um, family history of gout. If you have a family history, you have that going for you. Age and sex. Hey, I got it all. You know, gout occurs more often in men. Ta-da! Primarily because women tend to have lower uric acid levels after menopause. So, however, women's uric acid levels approach those of men. Men are also more likely to develop gout earlier. So, usually in our 30s and 50s. All right. Um, Usually, it's very rare that you would have surgery for this, but usually a surgical event can cause gout. Okay, because the uric acid gets built up in the bloodstream and causes it. Now, gout is very uncomfortable. It's painful, and it's usually in the joint area, and most of the time it's in the big toe. So now I know that this slide is on osteoporosis, osteomyelitis, osteosarcoma. With my discussion, you should have had enough time to read over that as I was jabbering away about something called gout. So you should be able to figure out that osteosarcoma, cancer, osteomyelitis, an infection in the bone, osteo being bone, my being tissue or muscle, and litis being an inflammation. Okay? And osteoporosis is the bone mass again due to the fact that you didn't have enough calcium and vitamin D and exercise to build up your calcium, your bone density uh, before you got older. So we discussed all three of those. Here are the curvature of the spine. The kyphrosis, which is hunchback, is usually in the elderly. As you notice, have you ever seen individuals walking with a cane, how their upper back is hunched over and they're looking at the ground all the time because they're bent over and they got the cane and they're looking down. Well, they really can't straighten up like this and walk like this. Now, I often wondered, they're getting to the point where they're no longer desiring for people to have the cane like like the old canes where they got the lid on the top. You put your hand on top and you use them to walk with. It's more like a staff, like in the the fairy tales and movies. And they're thinking about getting back to that staff because it keeps you more straight in your stature, and it helps you fight that kyphrosis and the hunchback. So it's an interesting philosophy. The reason they're getting the ideas from shepherds in the fields, they don't use a cane, but they have a staff to keep away critters that eat the sheep and those kind of things. And they walk with a staff quite a lot. They don't seem to have the hunchback. But then again, it could be just the fact that they exercised and had lived a non-sedentary lifestyle their whole life and had built up and avoided osteoporosis to begin with. So there's a lot of things going on, but sometimes things make full circles in life. Um, we used to all have staffs at one time. Now we're thinking about going back to those rather than canes. Now, lotus is a sway back, and that can occur in young as well as old. It's a sway of the back, like you just the big O goes like this, whoop, like an S, whoop. But the thing is about the lotus is that you can really see it. And you ever seen the horses that have the sway back? That's where they get that. That is a lotus. But you can imagine in humans or us, it's when you're standing up, you've got that sway back. Okay. Now the other one here is the scoliosis, which is a side or lateral curve like this. All right. So your hips and everything are like that, and your spine is literally like that, but it's still up, but you're swayed like that, like an S shape of the spine. But it's not sway back, and especially prevalent in teens to straighten the spine. So they may have to have braces to do that with, and it usually can be prevalent in young teenage girls. Uh, and those there's a lot of things that can be done to treat this. So it usually can be prevented as well if you know that you have a history of it. So you need to see your family pediatrician to get them diagnosed early and to prevent this discomfort and this deformity from affecting them for the rest of their lives. So they're all treatable. So that's important to know. I mean, to me, both of these are just saying this is what I am. Arthro is a means joint, and scopy means to look. So they're going to take a peekaboo in your joints, which is basically what this is. It's a procedure that you use a scope, uh, penetrate the epidermis, and visually examine the internal structures of a joint. So they're taking a look. So now arthroplasty is just like a repair. Arthro is the joint, blasty is repair. You're going to figure out a way to rebuild this structure and repair the injury, and um, and that's what you do. So that's what those two words mean. Basically, if you just break them down into their parts, they tell you what I am. So it's pretty cool. And I don't know if you had medical terminology yet, but that's pretty much how these words are formed to begin with in medicine. So just a moment. This is the end of the lesson. The next slide group will be concerned with the actual structures of the skeletal system, their nomenclature, and how they grow, and things of that nature. So I want to leave you with references that are available to you. Um, there's an online book that you can have access to through our Engage program. It has a search prompt that you can put any word in, and it searches the entire book, so that you can find information on certain areas that you desire or need to know. Um, there's also faculty availability, which is in the Blackboard portion. It's a prompt. You can click on that. Faculty availability gives you the information you need to contact your primary instructor for a little one-on-one instruction. Then we have the UMA library. The UM library is a great reference tool. It's a library. It's online. It gives you access to videos, journals, books, textbooks, and various other resources that you could use, graphs, charts, photographs, uh, about structures and things in the anatomy. So using the UMA library is a great resource. So once again, it was great being your instructor during this particular lesson, and I wishing you all the best.